Hi, my name is Christina Tallman, and today we are going to be talking about motor neurons, more specifically the reflex arc. And for an example, we are going to use the knee jerk test. This is the test you might have experienced in the doctor's office. This is when they hit your knee with that rubber mallet to see if your knee will kick up. And today we'll talk about how that happens and why that happens. So to get started, we're going to use this chart we've created, and basically what this lays out is the flow chart from afferent side to the efferent side, and we also have this interneuron in here, which is going to play a little bit of effect later. So to get started, we have our layout of our knee. So our quadricep muscles over here, if you notice how they're attached and where they're attached, when they contract or get smaller, they are going to cause the knee to kick outwards. This is called a knee extension, and this is the goal of our knee jerk test. However, these muscles down here are hamstring muscles. If you look to where they are attached, they will do the complete opposite, and they will cause the leg to go backwards. And so this would be called a knee flexion. So we are going to use this gray circle right here as kind of our representation of our mallet. And so our mallet is going to strike below the kneecap, and what it's going to do is it's going to pull from here up through the muscle. And it's going to be a very quick pull. And so we are going to sense this in our body, and to sense this we are going to use our afferent side. So if you remember, we talked about this before. We have the acronym SAME, S-A-M-E, and so sensory is going to be afferent, and then our motor, which we'll talk about later, is our efferent. And so we have an afferent going from our muscles to our spinal cord. And more specifically, if you want to refer back to the chart that we've talked about before, the muscle spindle that we're going to use is going to be related to speed, because it's going to be a quick contraction of the muscle. It's going to be quickly stretched out, and so we're going to use type 1A. So this is going to elicit a response. And our muscle is going to want to contract in order to counteract that quick stretch that it felt. And so we're going to have our motor neurons come into effect. And so if you think about it, our acronym SAME, motor is our efferent. And so our extrafusal motor neurons, also called our alpha motor neurons, are going to come into play here, and they're going to cause the muscle to contract. This is also going to cause those intrafusor motor neurons to contract as well. And so we will talk about later how these alpha and gamma motor neurons interrelate with each other. And so if you think about it, if you look at the picture, we're not done here, because we have this muscle connecting here, and we have this muscle connecting over here. And if they were to both contract at the same time, there would be some trouble in the bone and with the tendons, and some things might break. And so what we need to do, while this muscle is contracting, we need this muscle to relax. And so we need those interneurons that we talked about to come in and prevent our hamstrings from firing. And so our interneurons are going to come into effect, and they're going to inhibit the contraction of our hamstring muscles over here. So another example that we will talk about later is when someone reaches to grab your arm, and you're going to want to pull away with the arm that's been grabbed, and you're going to want to push with the other arm. And so it's a very similar reaction, and we will talk about how we have our one side of our arm is going to contract, and then the opposing muscles are going to want to relax. And so we will talk about that next time. Thank you.